Hey everyone, welcome back to the Heal with Grace podcast. I am your host, Grace Secker, a somatic trauma therapist and nervous system coach, and I'm so glad you're here today. We're diving into a topic that I actually just posted on Instagram about, and it got a lot of saves and likes and comments and questions because it makes sense. Like it's the time old question, are my symptoms caused by my nervous system? I get messages like this all the time. What about this symptom? What about that symptom? What about the inflammation that I show in my body after a scan, or the bulged disc or herniated disc that I have in my neck or my back? Or, the number and one test you can do that show you something, or the lack of findings that they have with something that you're experiencing. And everyone is like, well, what if it's this or what if it's that? And basically, I am here to answer the question of, is it nervous system based or not? I'm going to give you a list, a checklist where you can go down and ask yourself these questions and then also give you examples too. Let me just say this one thing. Before I became a therapist, as you probably know by listening to this, I dealt with so many different symptoms throughout my life. Even as a therapist, I dealt with so many symptoms, so many physical symptoms. And because of the medical model these days, most people think that physical symptoms are caused by some type of physical abnormality, disease, something in the body. Now, I'm not saying that what you're experiencing is not real. It is 100% real. You can actually see that there is something quote unquote wrong, something going on in your body, but that doesn't always mean the treatment comes from a physical place. Now, physical in terms of brain or nervous system, yeah, but not in a traditional type of treatment modality that we often understand. So, in today's episode, I'm going to walk you through exactly what neuroplastic symptoms are, what are nervous system based symptoms, and what they look like in real life, and give you a checklist, like an actual checklist, so you can determine if your symptoms might be caused by your nervous system. By the way, if they are, it's really good news because it means recovery is 100% possible. So let's dive in. Okay, let's get really clear about first and foremost, what do I mean by when I say the nervous system? There's so much out there about the nervous system these days. So I want to just have a clear explanation of what this is. Think of it this way. I like to say that your nervous system is the information highway. Your brain is a control center, and your nervous system has messages sending going up and down the nervous system from your brain to your body. Every single second, signals are traveling from your brain to the rest of your body and back. And these signals control everything: pain, digestion, inflammation, hormones, immune function, heart rate, literally everything. And this is happening constantly without you even thinking about it. Your brain is receiving information, processing it, and sending signals back down that highway to tell your body what to do. Now, here's the key, that if your brain senses danger, and this could be physical danger, emotional danger, spiritual danger, mental danger, anything, or even perceived danger from the past trauma, past situation, past experiences, it then sends protective signals down that highway, even if the perceived danger or threat is not present or is not real. The signals are real, and they create real physical symptoms: pain, fatigue, inflammation, digestive issues, all of it. The brain is trying to protect you. That's its job. So when those protective signals stay on for too long, the danger mode doesn't turn off. Then your symptoms can become chronic. And that's what we call neuroplastic symptoms. If you've been in this world for a while, we used to call it TMS, tension myositis syndrome. Now it's neuroplastic, and that's the term we're using for nervous system derived disease, symptoms, illness, all of the things. So, neuroplastic symptoms are real. They are really happening in your body, physical symptoms, but they are caused by the brain staying stuck in danger mode. And they are not just quote unquote all in your head in the way people sometimes mean. They're not just anxiety, they're very real. But the root cause isn't structural or disease, it's a nervous system that's stuck in protective state. So this can happen even when testing comes back normal. Actually, this very much so happens when testing comes back normal, but this actually happens when testing doesn't. So, because our bodies as humans, we are not perfect. So, if you go turn over every stone, you are going to find something wrong. Again, because we're not perfect, the human body is healing and changing all the time. So there's going to be adaptiveness. There's going to be tests that show that you have low levels of X and high levels of Y, and that you have a leaky gut, and that you have low motility, and that you have abnormalities in your spine, or that you have inflammation in your bladder, or X, Y, and Z. You're going to find things because our bodies are not perfect. It's completely normal and natural to have aging and things that are not perfect, essentially. So, the thing is, those issues, those things in our bodies do not need to cause pain because they are normal parts of bodies and aging. That's what I want you to understand. So let's get down to actually what do neuroplastic symptoms look like? Let me give some examples. You've probably heard me talk about some of these, but I want to really list out multiple different ways that this shows up that maybe you've heard some of these things been told to you. So maybe you have chronic headaches, maybe they're migraines. If you've been given the label of fibromyalgia, which comes with so many different things, right? Essentially, it's just like pains all over your body. CRPS, ME, CFS, chronic fatigue syndrome, long COVID, Lyme, POTS, chronic dizziness, MCAS, mast cell activation syndrome, IBS, and any kind of digestive issues or gut issues, back pain, neck pain, shoulder pain, pain that is caused by hypermobility. You don't have to have pain if you're hypermobile. Vertigo, pelvic pain, interstitial cystitis, an overactive bladder, brain fog, and any chronic symptoms that have lasted longer than 6 months and that don't have any structural findings. These are very real conditions, but they are derived from the brain and the nervous system. And what I'm saying is that in many cases, most of these cases, the root cause is the nervous system being stuck in danger mode rather than structural damage or disease. And here's what makes neuroplastic symptoms different. First, they often lack clear physical evidence, like you get an MRI, blood work, imaging, and everything comes back normal. Or maybe there's something that shows up like a bulged disc or some inflammation, but it doesn't fully explain the severity of your symptoms. Second, neuroplastic symptoms are inconsistent. They move around the body, they come and go at odd times, they're triggered by random things, smells, sounds, weather, stress, certain foods. One day you can do something, the next day you can't. That inconsistency is actually a hallmark sign of a neuroplastic symptom. So I have people come to me often and say, "Well, I had this flare. I had these symptoms for like 2 years when I was 19, and then they just went away. But now for the past year or 2, it's back and it's worse." Or, once I asked people about their history and I asked them, "Have you ever had any other types of health issues or any other symptoms that were kinda weird or any other diagnoses?" And most of the time, not everyone, but most of the time people could be like, "Oh, yeah, I mean, well, I had this," or like, "As a teenager, it was always this," or like, "Maybe I was always sick here," or whatever, right? Like, yeah, kind of. That symptomology moving around all the time, that's your nervous system. Because if it was a true structural cause, then it wouldn't move around, right? So if you have cancer, if you have a tumor, that tumor doesn't move around your body. If you have a broken bone, that broken bone doesn't change. It's broken and it hurts for a certain period of time and then it heals, right? The inconsistency is huge. It also doesn't matter about weather. I correct this all the time. "Oh, it's getting cold, so my joints just hurt and like I just have pain because it's cold weather." There's absolutely no research to support that weather causes pain. I could go down a whole list of demystifying things that people say about the physical body. Again, I'm not saying your pain's not real. It's just that we hear these things and then our brain uses those to explain why we might have symptoms, to grab onto them. Thirdly, conventional treatments have failed to provide relief. If you've tried medications, physical therapy, surgery, maybe supplements, diet changes, and maybe it's worked for a little bit, but not long term, or things work for, a while and then they're back. That means it's probably more neuroplastic. Treatments should effectively treat. If any of this is resonating with you, I want you to keep listening because we're going to go into the more detailed checklist. Okay. So, this is the part where we really dig in. I'm going to walk you through the checklist of signs that suggest your symptoms might be neuroplastic. And this checklist comes from the symptomatic.me website, which is an incredible resource if you want to learn more about neuroplastic symptoms. So, grab a pen. If you want to take notes, save and bookmark this episode so you can come back to it, whatever works for you. Number one, your symptoms lack clear physical evidence. If doctors run tests, things come back normal, or at least the findings don't fully explain what you're experiencing, you might have some inflammation or a bulged disc, but it doesn't match the level of pain or dysfunction you're dealing with. This is one clear marker that it's neuroplastic, it's nervous system based. Number two, your symptoms are inconsistent. They move around the body, they come and go at odd times. They're triggered by random stimuli like smells, sounds, seasons, or the weather. Like I mentioned above, this is neuroplastic. It doesn't follow the rules of structural problems. Neuroplastic pain can be there one day and not the next, or it can be in your hip one day and your neck the next. And if you're someone listening being like, my symptom is there 24/7, you're listening to this for a reason. There's a neuroplastic based symptom there. It can feel like it's happening all the time, and that's okay too. Number three is conventional treatments have failed to provide relief. If you're listening to this, you have probably tried everything: medications, physical therapy, injections, protocols, surgery, functional medicine, diets, cold plunging, sauna, detoxes, all of the things. And maybe they temporarily helped, and maybe they've become support systems for you. And that's fantastic. That's fine. But if it's not actually helping you long term, that's an indicator that you have a neuroplastic symptom. Now, I want to say something about this here. I mean, you've heard me say this. I'm a supporter of things that help you. I myself have a red light mask at home. I love my sauna. I'll cold plunge when it's there. Like, I actually like those things, but they're not actually what's helped me heal and get to the recovered place that I'm in. They don't. They're just supplemental. Okay. And then all the other things. Like, I've done so many things, so many treatments, and still I have learned so much from all of them, but they have not actually gotten to the root cause of my symptoms. Okay. And number four is that you have multiple physical unrelated symptoms or a history of multiple chronic symptoms. This is like what I was mentioning above. If you're not just dealing with one thing or you've had multiple things in the past, back pain, digestive issues, headaches, fatigue, that pattern of multiple symptoms is classic for nervous system dysregulation. And it doesn't have to. You don't have to have all the things. You might just have one specific symptom, one syndrome. Many people do. That's that's still neuroplastic, right? If it still fits this criteria. Number five, you have personality traits that include being highly driven, hard on yourself, ultra responsible, perfectionistic, needing to feel in control. Maybe you place others' needs above your own. Things like that. You have more anxiety. I know this sounds a little odd. Like, when I first learned about this one, I was like, whoa, that's fascinating. There can be personality characteristics that are associated with physical symptoms in the body. But then when I started learning about it and I went down the list, I was like, oh, that's me. I was like called out, like so called out. And also now it just makes so much sense after you get into this work and you understand it more. And this ends up hitting home for a lot of people. When people come to me and they've already kind of learned about this, they're just looking for help with it. They'll already say, like, yeah, I'm highly anxious. I've got that perfectionistic tendency. Like, I'm a people pleaser. And this is not about blaming yourself at all. You're not causing your symptoms, you're not doing anything wrong. It's just about recognizing that these traits can create chronic stress in your nervous system. And when you're constantly in go mode, constantly trying to be perfect, constantly putting yourself last, your nervous system never gets a break and it puts a lot of pressure on yourself. Number six is your life has been marked by high levels of job, family, relationship, or social stress. This is such an umbrella, right? Because what is stress? Now, you can listen to my other episodes on what is trauma and what is actually considered high stress for your nervous system. And essentially, it is something that your nervous system deems as too much at once, or too much over time, or too much, too fast, too soon. Chronic stress is one of the biggest contributors to nervous system dysregulation. And this can be current stress or past stress that your nervous system is still holding on to. Chronic stress, like hear that, right? Like, oh, that's stress isn't good for your body. It truly is the cause of our body's syndromes and symptoms and illnesses and pains. So this work is about unraveling that, getting you out of that and learning to teach your body that it doesn't have to be stressed anymore. That was not a part of this. I'm telling you how to treat and we're going down a list, but you get what I mean. Okay, number 7 is if you learned that a child was experiencing what you did as a child, would you feel sad or angry or upset? So I want you to ask yourself this question. Dr. David Clark talks about this, and actually, he was on my podcast a while back, and we'll link the episode below. And he says, I really like to ask people when I ask them about stress, like, what has been stressful in your life? Do you have any trauma in your life? And a lot of times, people are like, I don't know, I had a fine childhood, or no, I don't have any trauma. The question that you turn back on them is if someone was describing what you experienced as a child or what you're experiencing now or what you have experienced in a high stress time in your life, how would you respond to that? How would you feel about it? What would you say to them? Oftentimes people don't realize what they went through was stressful, was hard, was difficult, was trauma. Because when we go through it, we're not thinking about it, we're just in it. And so trauma doesn't have to be big T, capital T trauma, which actually I don't even like those terms, big T and little t. We don't even need those anymore. We're just talking about trauma. We're just talking about nervous system that was pushed past capacity. It can be emotional neglect. It can be like you had to feel like you needed to be perfect or not feeling safe enough to express your emotions, or parents who were stressed or emotionally unavailable or physically unavailable. If you look back and you think, wow, that must have been hard for little me, that is significant. That's nervous system dysregulation, or that causes nervous system dysregulation. Number 8 is that you have experienced trauma or a terrifying or horrifying event. Again, it doesn't have to be some huge event, but if you have experienced it, you have a high likelihood that you have neuroplastic symptoms because your nervous system is trying to protect you from the feelings about that event. So, how many of those resonated with you? If you checked off even just 1 or 2, there's a very good chance that your symptoms are neuroplastic. And listen, I know it can be overwhelming, and you might be thinking, wait, so you're saying my pain is coming from my brain. Does that mean it's not real? Again, no, your pain is very real. It is very, very real. This is good news. Like, truly, this is good news, because if your symptoms are neuroplastic, that means that they can be treated by changing your brain and nervous system response. We have so much evidence now. Just go listen to the success stories and the healing stories I have on here and then on so many other people's channels and podcasts. People are recovering, people are healing, and it's completely possible. I've seen this over and over, and I've seen this in my life and the lives of so many other people in my community. When you learn how to regulate your nervous system, when you teach your brain that it's safe, when you rewire those protective signals, symptoms can improve dramatically. Sometimes they go away completely. This is literally why I started this podcast, is just to teach you that this is possible, to help people understand, right? To help people understand they don't have to be sick and in pain forever. So, first and foremost, if you're listening to this and you're like, ooh, someone else in my life needs to hear this, please share it with them. Again, this is the whole point of the podcast. Let's share the information, let's get it out there. And then, secondly, if you're like, oh, yeah, this is me. Okay. Like, I definitely want help with this. That's exactly what I teach in the Mind Body Healing Method course. And right now, it's the self paced program where I teach you how to rewire your brain, how to regulate your nervous system, and how to understand and express your emotions so that your nervous system doesn't have to be on high alert. We address it all: nervous system, somatic practices, brain retraining, and trauma. And the beautiful thing is, you don't have to do it alone if you don't want to. Even though this is self paced, you can add on as needed private sessions with me or Liana, my mind body healing method coach, and you can get that personalized support. Let me recap the key takeaways from today. One, your brain is the control center, your nervous system is the information highway. And when your brain senses danger, it sends protective signals that create real physical symptoms. Two, neuroplastic symptoms lack clear physical evidence. They are inconsistent. They don't respond to conventional treatment, and they often involve multiple unrelated symptoms. Three, if you checked off more than one above, your symptoms might be neuroplastic. And if they are, it's good news because it means they can be addressed through nervous system work. And last but not least, recovery is possible. I've done it, my clients have done it, and you can too. And I would really love to support you in that if it feels right. So if you're resonating with what we've talked about today and you want to learn more and you really want to be guided through it in a step by step process, I'd love to invite you to check out the Mind Body Healing Method course linked below. You can find the link in the show notes to start your healing today. Thank you very much for being here. Thank you for trusting me with your time. And remember that healing is possible. Your body is doing exactly what it's supposed to do. We just need the right tools to teach it that it's safe again. I'll see you in the next episode. Keep healing with grace.